My story is, I've had multiple family members who have had cancer, and probably the most formidable time in my life, one of the most formidable times in my life was when I was a teen and watched my grandfather die of prostate cancer, and was really a wake-up call for me to see kind of like this is the conventional model and what it does to a human being, turning somebody from somebody who was that robust playing golf to somebody who was undergoing chemotherapy and radiation and in a hospital bed, and really made me focus and be passionate about kind of taking a different stance and a different approach and looking at oncology and doing whatever I could as a naturopathic doctor to help manage my patients. So this particular patient was an early stage cancer, a patient with cancer. And, the questions for consideration in this case are, how can functional lab testing help guide you in working with patients with early stage cancers? And what are integrative or functional treatment strategies for improving metabolic and hormonal health in patients with breast cancer? Okay, so we have another patient here with clear-cut metabolically tied relationships to hormones and the development of breast cancer that we'll be talking about in this case. Okay, so this is the patient's labs at baseline. I want to point out a few things, not every single test on this panel, but ferritin is usually a sign, not necessarily that the patient has a lot of storage form of iron. In this case, the iron levels were normal, but usually because of metabolic involvement. So we see ferritin levels, it's a non-specific marker of metabolic inflammation. So that's why this ferritin was high, because as you can see, this patient also had very high levels, not very high, but high levels of triglycerides. She also had high levels of hsCRP and insulin levels. Okay, insulin is a driver of cancer, as we'll talk about in a second. She also had a borderline hemoglobin A1c. This measure here is a marker of long-term blood sugar control. Okay, we look at this a lot in diabetics to monitor how somebody is doing on treatment. So you'll see her number was smack dab up against the border of that pre-diabetic range. So really she came in kind of at a good time, to really be able to still do something about this. She's not diabetic, right? But she definitely has insulin problems and metabolic problems as evidenced by the triglycerides, the insulin, and the hemoglobin A1c, and the ferritin, okay? Also, her hsCRP was quite high at 7.0. So again, as we just talked about, this is an estrogen-related problem. This is an obesity-related problem. This is an inflammation-related problem. And that's where that was coming from for this particular patient. Okay, so insulin and cancer. In healthy individuals, blood glucose concentrations are maintained within a very narrow range, right? We eat a meal, pancreas releases insulin. It allows these things called glucose transporters to move to the cell surface where the insulin comes inside the cell and everything returns back to normal, right? However, in insulin resistance, what happens is that the cell receptors for insulin stop responding appropriately. And we get insulin resistance, and that causes the blood sugar to elevate inside the blood. It also causes more insulin to be released because the body doesn't think it has enough. And then we have high levels of insulin, which can cause growth, okay? And as you can see, it's related to different types of heart problems, including coronary heart disease. And it's even related to neurodegeneration. We now think that insulin is a driver of Alzheimer's disease. So we're calling Alzheimer's disease type 3 diabetes because of the relationship that it has on the brain and kind of this co-pattern with diabetes, insulin resistance, and insulin resistance at the level of the brain. There's also a growing body of evidence that indicates that there's an association between type 2 diabetes, insulin resistance, and the increased risk of especially our metabolically, hormonally driven cancers. That is breast cancer, prostate, colon, endometrial, and ovarian cancers. Elevated fasting insulin is also associated with poor breast cancer outcomes. Okay, so again, that is a really important facet for this patient. Yes, this patient's insulin levels are quote unquote in the normal range for this lab. However, my optimal range for insulin is roughly between 3 and 9. 3 and 9, roughly speaking. The closer, the better that they can modulate their insulin levels, the better. Okay, so elevated fasting insulin is associated with poor breast cancer outcomes because insulin is a pro-growth hormone. So this is the generalized approach in integrative oncology that I follow. So the foundational aspects are metabolics. For this patient, that was extremely relevant, right? We need to focus on improving the metabolic health for this patient. Food, that of course ties to metabolics, but also what are the best foods to eat to diminish inflammatory load, right? What are the best foods to eat to minimize environmental toxicant exposure? So food is very, very important. And then lastly, muscle. This is most relevant for patients who have advanced forms of cancer. I would say that's important for this patient to exercise and build muscle, especially in the realm of being insulin resistant and potentially on our way to diabetes, but not necessarily from the perspective of wasting, which happens a lot in cancer. Some of the root cause things we look at are physical activity, nutrition status, how well somebody's sleeping, and those circadian rhythms, which do contribute to cancer formation, stress, as we just talked about for this patient, mental, emotional, and spiritual connections, again, environmental and hormonal influences, underlying latent viruses. Sometimes these things can turn on or off specific cancer genes, inflammatory and immune dysfunction, as I mentioned a second ago, and then genetics. Genetics probably play about a 10% role. So it's what we're doing along the way, all these root causes that usually turn on or off the genetic predispositions. Okay, and then of course, these are other things that I do a lot in my practice: adjunctive, supportive, and quality of life management, depending upon where they fit along the cancer continuum. And these are things that I'm doing, things including high-dose vitamin C therapy that's done intravenously, or mistletoe therapy, or other types of management to help the patient navigate the waters of diminishing and even accelerating or accentuating chemotherapy and or radiation. So, and again, look at the double stars here. All of these things are modifiable risk factors, right? These are the things that we can change. We can have our patients change no matter where they are along the continuum, right? We can improve those facets and improve health, no matter where you are along the continuum of health in general. So for this particular patient, we had her to focus on metabolic health, focus on her foundational dietary belief structure. She was trying to be more vegetarian, even trying to be vegan, but we kind of had a good talk about what are the best foods to eat for her to navigate the waters of metabolics and cancer. So we actually recommended a Mediterranean or Paleolithic diet for her. We'll talk more about those in a second. With a dysregulated metabolic pattern, and overweight is paramount to correct blood sugar imbalance. Can't stress that enough. Really making sure to optimize protein intake and muscle mass, and limiting refined carbohydrates and carbohydrates in general. Looking out again for those naked carbohydrates, making sure to eat fiber, the things we talked about a little while ago with the other case. A number of supplements are very helpful. Berberine, this is a product from Designs for Health. We recommend 1,000 milligrams per day, split up into 2 meals, especially the heavier meals. We'll talk about berberine in a minute. ALA, alpha lipoic acid, 1 capsule twice per day with lunch. I think it was 200 milligrams twice a day. Alpha lipoic acid is one of the supreme antioxidants. It's great for detoxification and free radical scavenging. It's also amazing for helping to sensitize insulin. It's also been shown to help patients to lose weight, independent of dietary modification. So ALA is truly one of my favorite nutrients on earth. Reducing inflammation and restoring immune health, we recommended fish oils. This was the same fish oil we recommended earlier for the other patient. And again, helping to lower cholesterol levels, helping to improve triglycerides, improving blood sugar control, and again, reducing inflammation. Vitamin D3, the patient did have suboptimal vitamin D levels. And again, pretty much in every single study looking at every cancer type, vitamin D has been shown to be helpful to reduce risk and improving outcomes, especially in the realm of breast cancer. We're helping her to improve adrenal health. Obviously, this is pretty beyond the scope of this talk, but we did talk about stress modification. We talked about meditation, breath work, and a variety of other things that can help her to improve her stress levels and navigate the waters of this cancer diagnosis, which of course is extremely stressful by itself. We also recommended a product to be able to help to regenerate and rebuild her adrenals. This is ADR formula. This has both adaptogenic herbs in addition to adrenal cortical extract from bovine source, from a cow source. So that's to help improve her cortisol levels. And then modulating estrogen levels. We recommended cruciferous vegetables. We recommended indole 3-carbinol from pure encapsulations. That's 400 milligrams twice per day. And then increasing fiber in the diet, recommending 2 tablespoons of ground flaxseed in a smoothie per day.